Hello, everyone. Welcome to The Silver Lining. I'm Kevin Ashley.
I'm Nicole Littlefield.
And I'm Danny Oliveris.
And today we have a really special guest. Would you like to introduce yourself?
Sure. My name is Dilyss Gallyot. I'm a nursing professor. I've been teaching at the college for the last 17 or 18 years. Presently, I am teaching one course because I am the interim dean of nursing and health science and the director of nursing. Just wanted to put that straight out there to say that my colleagues who are teaching a full complement are teaching quite a few classes online or in a VCM mode. And I know in March we'll be doing some hybrid courses. So just letting you know that I can give you a little insight into the teaching perspective. Here we are.
All right.
Thank you for joining us.
Yeah, thank you for coming on. It's going to be great talking about all like the different things the college has been doing for like us, for COVID and all these different things. So, yeah.
Yeah, I think it'll be important to bring this to other students that might be wondering what's in store for the future or like the upcoming semester, especially since we're so close to starting the new semester and whatnot.
Yep.
We are. There's a delayed start for being on campus. The delayed start means we start on March 1st to actually have students on campus. There are some programs who are running just because there's no way they could run any other way but to be on campus. So I can give you some insights. We just like we ran in fall, everybody's going to be screened. They'll be asked questions. Mask wearing, I'm sorry, my friends, I think mask wearing is going to be happening for quite some time. The reason for that is that even when if people get both vaccines, because they don't know about 100% about the efficacy of how much that protects them, even if you have both COVID vaccines, whether that's Moderna or Pfizer, if you get exposed to somebody with COVID, they're still saying a 14-day quarantine. So I think we're going to be wearing masks for quite some time.
But
so before we get into I'm sorry, Kevin. Before we really get into all of the COVID stuff, I was wondering if you'd be okay just kind of discussing what your role in the college is overall. You said you're the interim dean of nursing, and if you could just kind of what encompasses that job.
What encompasses that job? I am the interim dean of nursing and health sciences. I oversee all of the health science programs. That's about 31 programs, anything from long-term care, dental hygiene, nursing, physical therapy. We have an incredible diagnostic imaging program. There's radiography, sonography, MRI, CT, nuclear medicine. So we have many chairs of those programs, and I try to support them. They report to me. We have students in those programs. So part of my job as the interim dean is to support the faculty and the chairs to see that we get the resources that we need to do what we need to do. And as a director of nursing, part of what I need to do is think about the budgets for nursing and give input to the budgets, but I also work with the chairs of that program as well. So mine is sort of I call it kind of a funnel. People can come to me with questions, whether that's faculty or students. I do have students who contact me and say, I have a problem with this, or, I'm not quite sure about that. And so I need to get them hooked up with their teacher, get them resources to say, how do we do this better? Because I've been with the college for, I'm going to say 18 years. I've been doing this job since last February. I was asked to do this last February, and then we closed down 3 weeks later. So it has been a huge challenge to say from my dining room, let's see what we can do. But with that, the job of a dean is kind of vast. You interface with faculty, with upper administration. And so there's a lot of that. But one of the reasons why I still teach a class, because you can say, hey, why are you still teaching a class? Sounds like a crazy job. It is a very busy job. But for me, I need to teach just to stay grounded in knowing what my teachers do and what they're experiencing as well.
All right.
What is the one class that you are teaching?
I teach a class in the beginning of the nursing program called pathophysiology. It takes every disease known to man and squashes it into a 7-week course. And so I try to help my students pick out patterns of what's important to know as a nurse, because you're not going to know every disease that's known to man, but there's some things that you have to think about from a nursing perspective. In other words, if somebody is having a hard time breathing, sit them up. If somebody is, I mean, there's just things to think about, and I have to take those concepts and apply them for my nursing students for the very first semester. They, of course, are brand new. I call them brand new baby nursing students. We have a 4-semester program, and they just want to absorb everything. Well, it's up to me to give them the building blocks so that they can take that forward to their other classes.
It's only 7 weeks. That's I've taken some 8-week classes, and those were hard. I can't imagine doing 7 weeks.
It's really
especially with every virus known to man.
Yeah.
Well, viruses are just one chapter, but what I'm going to tell you is that it's really an 8-week course. Sorry, but I'm telling you that by the time you do orientation and you've got this and that, and you've got 4 exams, it's tough. Our kids are really resilient. In the nursing program, most of the nursing program courses are 8 weeks long, and sort of like drinking out of a fire hose. That's just what it feels like. And I say to all of them, I'm with you. I understand. Part of my philosophy as an instructor is that I'm going to guide you and help you. And if you need help, if you need more help, just reach out to me, because part of that is I was supposed to be working on my doctorate. Part of my doctoral work is how to build resilience in students so that they can rebound and move forward without feeling like, oh my gosh, because as students, I know you guys want to take everything in, but first of all, during this time, there's things you got to think about, the stresses that people are undergoing. They may not have a laptop at home, or they might be sharing it with many people, or dogs are barking, or kids are yelling, or whatever it may be. So there's an adjustment that needs to be made just for this time. The structure isn't quite there.
Yeah, I think that's a perfect segue into how has the pandemic changed the way you have to do your job now, how you teach your students, and how does that affect you as a teacher?
What I'm going to tell you about teaching during the pandemic from my a little perspective, because remember that my job is mainly administrative. From my teaching perspective, I've discovered that it takes me 3 times as long to teach something, because I even have, there's a calendar behind me. I used to have like a big whiteboard behind me. So I would turn around and start writing things, and then my students would yell, "We can't hear you. It's really hard to see." So then I'm holding up pieces of paper saying, okay, let's look at this and what this does. And even though you can share a screen, it's very different. I think that online learning is very different than face-to-face teaching. It doesn't translate quite as easily. What I'm going to say is that it's taken me a lot longer to teach what I would consider sort of baseline perspectives. And then there's always that check-in, like, do you understand what I'm saying? So that is something. Students reaching out to me, I had a whole lot more of that. Before I would be there, then I would go to my office. They could come to my office hours, or they would send me emails. This back and forth with emails is consistent. And I, as a teacher, need to be more available and respond at a quicker time. You can't, you can say, so 24 hours. Sometimes that's hard when your students are panicked about technology or about getting in. I brag about my students. I think they're wonderful, but they've already started to reach out to me to say, I've got this going on Monday. Is it okay if I'm a little late? Absolutely. Because I think that if you have classes that are scheduled at the college from one time to another, that's one thing. But now people are trying to squash their lives in around their classes as well. So as a teacher, I'm just going to say that I've had to be much more flexible about certain things. Or when somebody says, I've gotten sick, I can't do this, you think, that's okay. How can we do this for you so that you can move forward? Because there's some of that that's part about what I'm going to say, a newer flexibility than what we had before. Before it'd be like, well, this is what we're going to do now. I feel like most of the rules were thrown out like, hold on a second, we'll get there.
Right.
So since everything has like changed for you and like all these different facets of like different, did you end up having like any part in the college's COVID creation plan, or were you just like known about it?
Kevin, I was the chair of the COVID task force.
Oh, beautiful.
So that was me and a bunch of faculty. We had classified people. We had a whole bunch of people on that team to try to say, how do we do this? What do we address? So that along with some of the cabinet members, we came up, it was a big cooperative effort to come up with what we have now for the college, whether that be we need you to sign these documents to say, hey, in my area, because they work with patients, if students come down with COVID, you got to report that right away. And coming up with some of those COVID protocols, as well as screening, keeping people 6 foot, having facilities go to every classroom to distance them. No, I was deeply entrenched in all of that.
Do you want to talk about how the process worked for this semester and how you guys planned out what you were going to do for the spring semester?
I could. As the administration was looking at what was happening last October, we saw our positivity rates for the state of Illinois start to climb. And as that positivity rate starts to climb and the number of hospital beds start to max out, we know that we're starting to climb that peak again. Well, as we started to do that in October, I sort of rang an alarm bell and said, we got to do something. And, and I'm telling you that there's many people, including Vice President Bente, who watches positivity rates. This is part of our lingo now. And we said, we got to think about how quickly can we get these students off campus. We had basically all we had on campus on fall were students doing hybrids. And we said, we need to get them off campus as quickly as possible because the chances of us spreading COVID to other individuals is higher. So as we started to get students off, we knew that coming back in January in a face-to-face mode would be higher risk because we were thinking of high-risk behaviors such as people being together for Christmas and for New Year. And we weren't seeing as many big group gatherings outside because it's cold, but people were spreading, and I see it now, people spread COVID more in their homes. They saw a friend, their friend had COVID, they then brought COVID to their family, and so that sort of locks down their family. However, delightfully so, this huge peak that we were expecting after the holidays really didn't happen. And our positivity rate, our state positivity rate is, I think the last time I saw it was like 5.8, which has been the lowest it's been since October. And so, we're all getting kind of happy about that, like, oh, look at that. And our hospital bed usage isn't up. Therefore, we're actually flattening that curve, which is a good thing. We decided on March 1st, way back in October, because we said, okay, what would be a safe time to start? January may not be, maybe March 1st, which sort of corresponds to the 12-week start time would be better. So that's kind of how we decided on March 1st. On March 1st, we're going to think about how we bring people back and sort of build that, because what I am so proud of, and this is the whole institution, we did not have one case of COVID that was spread in our college. We had about, if you think about the thousands of students that came and left, we had a total of 41 cases of people with COVID that were screened and kind of held on to. I believe it was 41. So if you think about that, in my area alone, we had 1,600 students coming and going. And so that's a miracle. When other schools were opening and closing and opening and closing, and then people had said, are you thinking about testing everybody? And I said, we could test people, but this is a community college. You go home. It's not like I can lock you in a dorm and say, you got to stay there. Mm-hmm. So testing somebody today wouldn't be the same as testing you tomorrow or the next day, or how long do you wait? And now we're getting more rapid testing available, but way back when we were starting this, some of the results were taking days to come back. So kind of gives you a false sense of security at times.
Yeah, but it's wonderful to hear that the college wasn't exactly like a hot spot. It just goes to show how the plan y'all created was not only effective, but a good example of COD excellence right there.
Yeah.
You know what? I'm telling you, it was a huge team. That cabinet met, the cabinet, the provost, every day they would meet and go over what cases were happening, what was happening and why. The dean of students was so involved in all that. I was not involved in that, but we were involved in sort of the planning and moving around. So I got to tell you, that whole team effort, faculty, students, and the whole team, they all did well. I mean, we're thinking about, well, what about when students want to congregate? It felt so bad, like, you got to go. And I had some students say, can't we stay and study together? Oh, that's heartbreaking to say. I want you to be able to study together, but not here.
The actions that must be taken in order to keep everybody safe, it makes perfect sense. Do you think come March 1st, so like what kind of classes will be opened again? Will it just be like similar to last semester where it's the hybrid courses that like need to happen because you need to have people taking them? Or will it be like more classes included?
I think, Kevin, that we're going to start with the hybrid classes. It has to roll out like we did last fall. There are classes that absolutely need to be done face to face. Kevin, you don't want a welder at home trying to practice welding on what, So you need to have, there are some classes, they have that kinesthetic component to them. I can speak for nursing. Who are you going to give a shot to at home? You got to think about those kinds of things. So the courses that need to have that psychomotor skills, just like the ones that absolutely need to be taught in a lab format, those would be hybridized and brought back. And right now we're all talking, right now some of the administration is talking about, how do we roll this out in fall? What do we do? Do we do this slowly as we start to see improvement? But from what I said this to some of the upper administration, I'm really sad about this, that we will not achieve herd immunity. Herd immunity means a larger percentage of the population is vaccinated, so they kind of protect the non-vaccinated people. We will not achieve herd immunity in 2021. That will be 2022, which is why we're still thinking like, what about social distancing? What about mask wearing? That's why I feel like mask wearing is going to happen for a while. My hope is that we have more face-to-face classes or mask-to-mask classes, as that is, in fall. That's my hope, because I know that students feel like there's at least half of y'all out there that say, I really miss interacting with people, and I understand that. Yeah, and so can I say for sure? I don't know. I'm watching as it sort of flattens down, and I'm hoping, because I want to say I don't know what's I think between the governor and Illinois Department of Health and many people, this has been incredible to have such a low positivity rate when Indiana has a positivity rate of 24.5, and you want to say, wow, okay, but people still have to, and I believe that people, I don't know about you guys, I am getting COVID tired. And with COVID tired, that means I'm tired of being in my house, tired of wearing a mask, tired of that. But that's the only thing that works. 6 feet apart, wearing a mask, moving forward. And so we see these kind of valleys where people just get really tired. And I believe that we're all social beings too. So as much as it's nice to talk to you guys, it'd be better to see you.
Definitely.
It's one of the massive issues when it comes to like dealing with something like this, is that once people start getting tired of these restrictions, they get loose, and which then this virus will peak, which only put down more restrictions and is counterproductive in the long run, but it's entirely understandable. So given the current, like we've mentioned vaccines a few times, are you like up to date or like active with the vaccine rollout at all when it comes to the college handling of it?
Well, we've been contacted. The college has been contacted by several groups of people to assist in rolling out the vaccine. Now, we keep saying, what's happening? What's happening? And part of it is the rollout through the Illinois Department of Public Health. And I believe, from what I understand now, there has to be a better coordination of how to do this. The college is poised to help, but we need to know what needs to be done. We can't just have people coming on campus to get vaccinations, kind of like they had in the flu shots before. Well, with the Pfizer vaccine, there's special handling with that because it needs to remain cold for a very long time until just before you're using it. With the Moderna vaccine, not so much, but the states have not gotten, if they say they're getting 10,000, they may have gotten 5,000. And we haven't gotten, we're supposed to be at 1B right now. People over the age of 65 should be able to do that. I'm going to tell you that people have been calling all over to say, when can I get my vaccine? When can this happen? They've been calling their doctors. They've been calling Walgreens. They've been calling CVS. And places just haven't gotten the vaccine yet. The college is working with people to try to say, we're here to work with you. But all of us are sort of in this holding pattern.
For somebody who doesn't know, like me, I'm kind of a moron and I have no idea what's going on with a lot of things. You know, I try not to pay attention too much to the news and whatnot, but can you kind of like break down how the because obviously the vaccine's not going to be readily available to everyone like right away, right? So there's like groups of people who get it first and whatnot. Can you kind of like break that down a little bit to like, you know?
Absolutely. You're not a moron. Don't ever say that. I work in healthcare, so I'm like right there. And then when they make you a task force person, you're like, okay, I got to be really focused. So Danny, don't ever say that about yourself. What I'm going to tell you that I understand is that we have to look at targeted groups first. First group that has to get the vaccine, healthcare workers. Why? They're frontline. The frontline workers are going to get the vaccine first, followed by people who are elderly folks, because we know that in certain cases, our elderly folks don't do so well with COVID. So get them the vaccine. Then we start to roll out and say, well, how old is old? You know, the next group that they were in the 1A group, the 1B group is 65 and older. They're starting to break those groups down. Then they'll start talking about, well, do you have diabetes? Do you have high blood pressure? Does that put you in a higher risk group? So we're looking at risk groups and vaccinating them and moving forward. I'm not quite sure when everybody will get the vaccine, but looking at some of the plans of, you know, people were saying this is going to take years if we do this. And I believe with some of our newer administration in Washington that hopefully we'll get more vaccine and a clearer plan. Because we've got to figure out who's at risk first, get those folks done, and then start to work our way down to say, okay, by the time you guys are ready to be vaccinated, I'm hoping that'll be mid to late summer.
So do people with pre-existing health conditions also factor into that as well, or is it primarily based off age?
Pre-existing health conditions are also taken into account. If Kevin, you were taking care of, let's just say that you were taking care of somebody who is elderly. Well, you may not have conditions. They say you're taking care of your 80-year-old I don't know, grandmother.
Yeah.
She would get the vaccine, but you would also get the vaccine because you're her primary caregiver.
Okay.
That makes a lot of sense. I'm not surprised that we're going to be I'm assuming one of the last people to kind of get it, since we're
Least likely to die.
I wasn't going to word it like that, but yes.
You have healthier immune systems, you have less comorbidities. But this virus impacts everybody. So just because you're younger, some of the stuff that I was hearing about early in fall, kids in other states, other state colleges coming down with COVID, eventually coming home and then dying at home. Oh, you know what? And I'm like, what? So I think that we need to be very vigilant about this. And I, you know what? I'm not Dr. Fauci, but wearing a mask, staying 6 feet, washing your hands. What feels very odd to me now is when I see my friends and you just think, hi, you know, I am a tactile person, and that is very difficult. When I look at groups of young folks, you guys want to be together. That's normal. You're social. But I said this a while back at one of the global ed talks. This virus is not, if you want to compare it to snow days, you know, when there's a lot of snow on a few days in winter, you're in your house for a little while. Then you get out of your house. Then you think, well, okay, is it a season? No, it's not a season. A season comes and goes. This has been over 10 months of this. This is much longer than a season. This feels more like an ice age. Like we're going to slowly start to change. There might be an ebb and flow in order to get this under control. And, you know, then I hear people panicking about, what about the mutations? We can't handle everything. What we can do is to vaccinate people. And there are some people who are just terrified of getting the vaccination. I don't know how to control the disease spread if you don't get a vaccination. Now, there are some people who can't for whatever biologic reason. I understand that. Look at Danny Koster me. Thank you, Danny. There's some people who can't get the vaccine, and I understand that. But choosing, and honestly, for me, you could say, Dilyss, why do you want to get vaccinated? I don't want to get COVID. I've had people around me who have gotten COVID, and, you know, I've done crazy things like I'll call them every day to see how they're doing, or I'll drop groceries on their doorstep and leave. But here's the main reason why I want to get vaccines. I do not want to get COVID because I don't want to give it to somebody else. I do not want to be the reason that somebody else gets COVID, whether that's an elderly person or a young person, because if something were to happen to them, I don't know that I could forgive myself for being what I would consider selfish.
I feel like that's the main drive for like a lot of people, with like not wanting to spread it. And it's one of my like main frustrations when it comes to like my generation and how like we've handled it, at least people in college, of how like, since you're not going to die from the virus, people, when you're around our age, chances are, people are a lot more like let loose, like, oh, let's get it and get it over with and all this different stuff, which is like, okay, I get that. But the virus also has like long lasting effects. Like it's been shown to, it's like, isn't COVID not really a lung disease, but like a vein disease, and it affects like blood flow or something?
It's a disease of inflammation.
Yeah. It
does impact your lungs, but it causes a big inflammatory response. And with that big inflammatory response, achy, hurt, flu like you've not had before, and it can have a residual impact that lasts much longer. You're not infectious, but you may have that cough that lasts a lot longer. One of the cardinal signs in the beginning that we noticed is that people lost their sense of taste and smell. Some people aren't getting that back. Some are, but it takes quite some time to do that. And you want to say, well, how bad is that? Well, you know what? If you're relying on some of those things to tell you something is good or bad, that's important. There are many other residual effects of COVID as well, even neurologic effects of that. So, well, people think it's just lungs. No, it affects, and what puts you at risk if you have diabetes. Diabetes is another one of those inflammatory kind of things. If you have, and there's some people who don't know that they have some underlying disorder. So it will trigger, not that disorder, but let's just say Danny didn't know that he had, I don't know, some autoimmune something because it was sort of latent. It can cause a fair amount of damage, which triggers those kinds of things. Now, look, I've depressed everybody now, but well, we need to get it under control is what we need to do.
Well,
and knowledge is our best friend in these types of instances.
Exactly. And that's why we want the vaccine. Like you were saying, people are worried about the mutations, but I was listening to something that Dr. Fauci was saying and how no corners were cut with the science side of the portion. And so I don't quite understand why people are scared to get the vaccination.
Nicole, that's such a great point. I think that people, there's a very big divisiveness in our nation that's sort of like, I don't know if I can trust this. It was done really fast. I understand some of that, but I don't want to live like this forever. This virus, besides isolating us, has had a crippling effect on our economy as well.
Mm-hmm. Mm-hmm. Yeah, it's kind of crazy to see how much this virus has like just completely changed everything, like our livelihood essentially, as someone who works like in medical, did you ever think that this would be possible in our lifetimes? Like I think we've all kind of discussed how like, a century ago, or 2 centuries ago or whatever, when we had like the Spanish flu or the Black Plagues and all that stuff, it's like, okay, I get that, because they didn't have iPhones back then, right? But we have iPhones now. So how is it possible that, a flu is, destroying us at this point? Did you ever think that would be like something we would see in our lifetime?
Well, Danny, I'm not a century old, but I feel that way sometimes. But I will tell you that we have in healthcare, we have a disease that impacts different generations. Okay. Way back before you guys were even a thought, when I was in nursing school, we were dealing with HIV. And there was such a scare about HIV and how it was going to wipe out people in the United States and how it was going to do this. And they were going to test healthcare workers for HIV. And I was like, what for? What is that all about? And so I was heading into a brand new disease that killed your immune system that you had to be kind of terrified about. And so I'm going to tell you that as a nurse, it was like, okay, here we go. I don't know how to, but I was still going to take care of people. And, you could say, well, that's kind of different from coronavirus. It is, and it isn't. A few years ago, my students, I adore my students, you need to know that, but they were terrified of Ebola. They said, I don't want to take care of people with Ebola. And I was like, why do you think Ebola is coming here? And as much as I do want to say we have our iPhones, we have our cell phones, why can't we do this? We live in a very independent country. In other countries where they track you with your phone and they check in with you, I don't know that would work really well in the United States because they would feel like it's an infringement of your privacy.
Yeah.
So we noticed a difference in countries where they're more communal, they work more as a community than countries that are more independent. So I can say New Zealand, who's surrounded by water, they had a total of 38 cases of COVID. They shut everything down. Now, I want to say they may have the same population as the city of Chicago, but 38 cases. That's it. And they shut everything down. This is what we're going to do. They celebrated New Year in a normal way. This has to do with some of our independents and non-independents. We have contact tracers who are noticing that if you're in a part, one of my friend's husbands is a contact tracer, and he earlier in this maybe a couple months ago, there was a party of 40 people that got together. 38 out of 40 people got it. So it's extremely communicable. Unlike HIV, you have to have contact with blood or body fluids. With this, you don't realize how far your saliva is being projected. Danny,
I keep coughing.
I love when Danny coughs to make that point. Thanks, Danny.
But yeah, it's
good thing this is over Zoom, right?
Yep.
We'd all be going, oh, okay.
Yeah, dang it, Danny's cough made me forget my follow-up question. I had a thought. Danny, you want to go?
I'll jump in real quick. So going back to that whole our independence kind of being a factor of how it lets the virus kind of run a little bit more rampant here in our country. So
I feel like we're individualistic to a fault at times.
Yes, yeah. So when it comes time that say the vaccine is way more, it gets down to our age group, right?
Mm-hmm.
Would there be a mandate to be vaccinated to come back to campus, or
Oh, those are such big discussions that we're having now, and I don't think that. No, we're actually having those discussions now, and it's kind of hair raising if you think about it. I do not believe that you can mandate that for our school. That being said, how do I keep all of you safe? If one person decides they don't feel like they need to have that vaccine. The reason why we're talking about do we mandate this? Can we? Is that you can't mandate it at hospitals. You cannot mandate that your healthcare workers get this vaccine. It's highly suggested. If you're sick, I don't know what's going to happen. But we're just in the talking stages of that. I can tell you, being the Dean of Nursing and Health Sciences, if my kids are taking care of patients, like if you're in physical therapy or X-ray or wherever you are, if you're taking care of somebody, you're going to need to get a vaccine because you're not going to spread this to patients. But what about people who are in automotive? What about people who are in art? There is, and that's where that individualistic society comes in, because in other societies, I'm not saying that we need to be fascists, but in other societies where they say everybody's going to get this, that's it. Been able to lock it down a bit. And I do believe that we cannot mandate it for all of our students when we come back. That's a huge, 25,000 people.
Mm-hmm.
Uh,
Uh,
Kind of difficult to do.
I remember I'm sorry, Kevin. I remember being younger, going to elementary school. We had to have certain vaccines, right? How is it that is kind of a mandate in a way? Or I don't know. Like I said,
that's the exact question I was going to ask. It's in elementary school and middle school, we had to have shots in order to show up. So can't this be a similar situation where if you want to come, you need to take the shot?
It's still pretty new. And these vaccines are newer types of vaccines. The mRNA vaccine is very different than the oral polio or the dead virus or the measles. So I have to tell you, this is a little different. People are treading lightly with that. When you went to school, you did have to get vaccinated, but there were also some students in school whose parents chose not to get them vaccinated for religious reasons. And so I need to be cognizant of that. But that is a very small portion of the population. I have actually seen healthcare workers saying, I'm not comfortable with this. What I have seen with the vaccination, whether it be Pfizer or Moderna's, with the first vaccination, people haven't really felt anything. With the second vaccination, they've seen a few more temperatures, aching, a few more symptoms, and they've been telling people, if you can, take an ibuprofen before you come in to sort of level off some of that.
All right.
I did not know that. That's very good information. I'm glad that I know that now.
Mm-hmm. Oh, I also heard recently that the schedule between both shots has increased. Is that an actual thing that's happening, or just something I just heard?
No, they want you, the logistics of getting this shot, you get one, and then a few weeks later, you get the next one. trying to get people back and saying, you must come here to get this shot. What they've noticed is that some people aren't coming back. And they say, well, you know what? If you start with the Pfizer shot, they want you to get the second Pfizer shot or a Moderna. And now they're saying, hey, we just need you to get a second shot. We don't want you to wait as long as, and I heard this and it makes me very anxious, 6 weeks.
Yeah, that's what I heard.
Yeah, you know what? They can say, well, it looks like if you get it within 6 weeks of the first shot, it's still okay. You don't want to play those games. You want to get it first one, schedule the second one, get the second one, and moving on with your life, because you still have to wait 28 days for that to actually kick in. Once you get a vaccine, you're sort of giving your memory cells, you get memory cells that once they see that substance, they will start creating your immunities. Once you get your second shot, they will build on that, but it still takes 28 days after your second shot to say, okay, you should be okay. You should be free from getting coronavirus. You should be.
So the vaccine only works if you get both of the shots?
Johnson & Johnson, there's about, within a short period of time, there'll be like 5 different kinds of vaccines. The 2 that I'm talking about right now, you have to get 2 shots. For some of the others are different. They're made differently. You might only have to get 1. So all of that will come out and confuse everybody as well.
You see, I'm just picturing it now. By the time the summer comes along, where I'll be like, oh, so what vaccine did you get? Oh, I got the Johnson & Johnson. Oh, I got Pfizer over here. Pfizer? You really just had Pfizer? Oh, it's a whole mess. It's going to be funny. It's good to see that, like, there is like an apparatus like building around this, and people like yourself are putting a lot of thought into these things. And we have been talking about like heavy stuff for a minute now, so I want to like lighten it up a little bit and ask you, did you see Dr. Fauci in recent interviews and how like happier and younger he looked?
You know, to not be oppressed is an important thing. How's that? To be valued for what you do is really important. And I think for a while there, he was taking a lot of pot shots for things. And you want to say, could we not attack people who are actually trying to help us? So but you know what? This is just me. And you could say, well, are you a Democrat? Are you a Republican? I'm going to say I am wildly independent now. I don't want to associate with any group, but I feel like I'm breathing a little better these days because I don't feel like I'm under all of that. Oh my God, oh my God, oh my God. The other thing that I get irritated with is the sensationalism of some things. Like, you know what? I know that every day there'll be COVID updates every hour on the hour during the news. Like, this is where we're at. No, this is where we're at. This is how many people died. And when that doesn't show up anymore, we'll go back to saying how many people were shot downtown. You know, it's like always something with shock value. So as things seem to be getting more under control, I'm kind of excited. Like, hey, look, you know what? And truly, when I thought, this is going to be a mess, what's going to happen in January? Look, things are actually better. Yay. So it is a little lighter. Considering where we were last year at this time, like what are you talking about? What's happening there? And now, you know, we're not out of the woods, but there's daylight that we're seeing, and there's always light. You just have to find it sometimes.
Yep. There is a light at the end of this tunnel, and there is also a silver lining, which is a nice little segue into the end of our little thing here. So what we do usually at this podcast is that we come up with something like a positive note or message that we want to send at the end of it to be like the silver lining at the end of what we talked about. And I was hoping that there was something you could say for the end of this, of how, like, is there like a light at the end of the tunnel that we can all clearly and now apparently see, or is there something that you're very cheerful for that you would just like to express?
Oh, Kevin, that's one of the harder questions that you've had to throw at me here. Something positive. Okay, so let me come around it from a very circular way. Looking back at last year, we did not know what we were heading into. Moving into this year, our numbers are better. We have a better handle on things. There is a vaccine. We're moving in the right direction. And that is nothing but glorious. Even with all the losses that people have had, and we've had, 500,000 is a lot of losses, but we're learning, we're doing better, and we're reaching out to each other. If nothing else, technologically, we're getting more savvy with everything. So I posted this, not that I'm a big Facebook person, but I looked at my oak tree in the backyard and it has buds on it. They always have a few buds, but you know what? That's hope. That's hope. That's what we have to hold on to. And it is going to get better. It may not be on our schedule, but I promise that it's going to get better. I promise that we are going to have students back on campus. We'll be teaching face-to-face. We might all be masked at the time, but it is going to get better. And you know what? You guys, our students, the reason why we have that college, have been extremely resilient in all of this. So got to tell you, there is hope out there.
All right. That was wonderful. Thank you so much for joining us. And despite how dark the clouds may be, remember everyone to always look for the silver lining. Thank you for joining us.